presentation today is about a patient with with beta-thalassemia major resulting in massive splenomegaly requiring a splenectomy. So a little bit of background. Beta-thalassemia itself is a genetic disorder. It results in deformed red blood cells and ineffective hemoglobin. While beta-thalassemia minor is pretty common, beta-thal major is much more rare. It affects about 1 in 100,000 individuals. The life expectancy is usually just 17 to 20 years old. These patients are transfusion dependent and have severe chronic anemia. So let's get started with the case presentation. We have a 33-year-old male immigrant from the Ivory Coast. He has beta-thalassemia major. While he was living in Africa, he would get transfusions about every 2 to 3 years, but since moving to the US, he would get transfusions every other month. He comes in with left upper quadrant abdominal pain and left-sided back pain. On exam, his vitals are stable. He doesn't have any symptomatic, any lightheadedness, dizziness, or anything like that. In terms of his physical exam, he has very thin extremities, but this very obvious protuberant abdomen that sharply contrasts the rest of his body. In terms of his labs, his hemoglobin is 3.4. Platelets are 21 and ferritin is over 1,000. Though he didn't have symptomatic anemia, he still required significant hematological resuscitation considering the hemoglobin that he came in with less than 4. He essentially did need a splenectomy. He did need surgical management to definitively treat the massive splenomegaly he had. As you can see in the CT scan, the image on the lower left side here, the spleen, that just shows how large the spleen is. You can see the liver and the spleen both there. The spleen is larger than the liver. The length of the spleen here is 19 centimeters. And that exceeds the definition for massive splenomegaly as having a length of greater than 17 centimeters or weight of 1.3 pounds, and he exceeded both of those metrics. The picture on the right shows an intraoperative picture. The organ that's bulging there, that's his spleen. Once it was delivered, it actually weighed about 10 pounds. So he did require surgical management. He recovered well. He was monitored in the ICU for 24 hours since he required multiple transfusions in the OR. In conclusion, he recovered well with a splenectomy. Having a splenectomy obviously helped his symptoms be relieved since those were all just from pressure from the massive splenomegaly. He had improved cell counts with improved hemoglobin, improved platelets, and required transfusions less frequently than before. What makes this case unique is that the beta-thalassemia major patients don't usually live until into their 30s. So since their lifespan is usually shorter, they oftentimes develop splenomegaly, but not necessarily massive splenomegaly. And that's what makes his case so unique. That's pretty much all I have for the presentation. And if you have any questions, I'll be happy to answer.
Yeah, so is allogenic hematopoietic stem cell transplant an option or consideration for this patient?
That's actually something that we had referred him to Hem-Onc outpatient to follow up with, and he hasn't followed up with them just yet.